Hello everybody! Today we are going to be talking about the medicinal properties of psilocybin mushrooms, which are more commonly known as magic mushrooms. So you may or may not know, but the active component of hallucinogenic mushrooms, known as psilocybin, can actually be used as an excellent treatment for patients with PTSD, anxiety, OCD, eating disorders, substance abuse disorders, and even untreatable depression. So first, a little background information. Psilocybin can be powdered and ingested via a capsule, but it's most commonly taken by eating the dried psilocybin mushroom. So although these pictures are very pretty, we're actually talking about this. Yummy, right? You can either eat the whole dried mushroom or you can make a tea with them, and they take an average of 30 minutes to kick in. However, sometimes it can take up to an hour, while others it's only 10 minutes, depending on what you've had to eat and drink that day and how much you've slept. Their effects usually last anywhere from 4 to 6 hours, but depending on the dosage, they may last longer. During this time, perception is altered and the individual may experience visual hallucinations. However, we're more focused on the mental effects of psilocybin for this video. According to my research, basically anyone who's taken magic mushrooms regards it as a life-changing experience that altered their perspective on the world forever. As you can imagine, no one says this about Lexapro, and the reason is this. Prescription medications alter the brain's chemistry, which refers to hormones such as dopamine and serotonin, while psilocybin simply increases the number of neuronal connections in the brain and connects regions that weren't connected before. In other words, neurons are sending more signals, which can ultimately be interpreted as a higher level of thinking. This higher level of thinking is what makes psilocybin so different from any other drug. With increased neuronal crosstalk, a person is broken out of their usual boundaries of thinking. We're all used to thinking in the pattern that we've grown accustomed to, and this actually becomes a barrier when it comes to dealing with mental health concerns. Psilocybin, however, breaks this barrier by allowing one to think in new ways that they otherwise never would have learned to. This altered way of thinking allows the patient to look at their life through the lens of an outsider, and it makes things much clearer. It can lead to life-changing decisions and conclusions for the betterment of the person's mental health, ranging anywhere from reducing stressors to forming a new daily mindset. The possibilities are endless, honestly, since every mushroom trip is unique to the individual and can be sculpted to their needs. So, if psilocybin is so effective, why isn't it being used as a current treatment? Psilocybin is still a Schedule I substance under the Controlled Substances Act, which means that there is no currently accepted medical use for it and it's considered too much of a safety risk for use under medical supervision. However, there are widespread medical uses for psilocybin in the field of psychiatry, and clinical studies have yielded significant results, with a 60% success rate 16 months later in a trial that used psilocybin as a smoking cessation treatment, and remissions of depression in other trials that lasted months and sometimes even years. In addition, psilocybin is perfectly safe for use under medical supervision. This kind of mushroom doesn't negatively impact the body in any way, and they're perfectly safe to eat. As long as a physician is present to guide the experience and make sure that the patient doesn't do anything to endanger themselves, there are absolutely no safety risks involved in this treatment. All right, and that is all I have for today, but thank you so much for watching. I hope you enjoyed, and I hope you learned something. Bye!